In this week's update, we will introduce you to a sector that we think have great potential from here on out.
But before that, we will go over the payroll data from Friday and the market update.
But be sure to hit that subscribe button and let's get started.
Payrolls increased 943,000 in July as unemployment rate slides to 5.4%.
This number was really good, but wasn't strong enough that the Fed would have to update the monetary policy. Well, at least for now.
We could see the Fed announcing a taper as soon as in the next few months if we continue reporting strong payroll data like in July.
If that does happen, it lines up with the right timing. August and September are historically rocky months for stock investors.
Looking at this week's market, and again, I'm getting tired of saying this, we are making new highs across the board. Yay! Well, besides small caps.
Not a lot of attention in the small cap lately. All the big money is focusing on the big names ER.
Including myself, alright? Looking at the S&P 500, we closed the week at 4,436. First support is around 4,395.
The FANG ER is not looking so hot, but the Nasdaq also made a new high this week and closed about 15,108. The first support is around 15,000.
It makes sense. It is difficult to continuously beat expectations and grow at this rate. The Nasdaq is getting carried by the semiconductor sector.
Let me ask you a question. You're holding cash, right?
About 80%.
What are you gonna buy with that?
Honestly, I'm not too sure.
Exactly. The market is at all-time high and I feel like it could have a major pullback anytime.
Well, the markets are making new highs, but the process isn't exactly smooth.
Yeah, the market shits every now and then, so it's really tough to find good opportunities.
But that doesn't mean we don't have opportunity either. There's one sector that has potential.
Oh yeah?
Take a look at healthcare sector. I believe it has a long-term potential.
Nah, boring. Pass.
Not so fast. They got good fundamentals and future catalysts.
Alright, tell me more about the logic behind this sector and what opportunities do we have in August.
Alright, so you wanna hear some logic. So first is part of the economic recovery. We are kind of done with phase 1 of recovery, and we can see that from slowdown of economic growth.
Ah, so that's the growth of manufacturing and raw materials. And now for phase 2, which is service sector's time to shine. And healthcare is a prototypical service sector.
And second, as we get COVID under control, we might see an explosion of healthcare demand. And now might be a starting point.
And COVID not only changed our lifestyle forever, it also pushed the growth of healthcare permanently.
Think about all the delayed surgery due to COVID. Those are all coming back, and likely will be coming back harder.
And not only that, new patients won't be decreasing. The new surgeries won't be decreasing either.
And third is the defensive nature of healthcare sector. Right now the market has generally high valuation and it is still making new highs.
And while that's happening, the risk factors are stacking up, such as growth slowing down, supply chain issues, inflation, long-term interest rates, as well as Fed is tightening QE.
Yep, any of those drops can get ugly. In risk-filled time like this, defensive stock will be the new hot topic.
Okay, I see. So healthcare is a traditional defensive stock with relatively low valuation, small downside, and with stable share price and consistent revenue performance. So, I think naturally it's fantastic if you want to both diversify or reduce risk for your portfolio.
Exactly. Take a look at XLV. We can see smart money is slowly flowing into healthcare.
Looks good, but I want something that's not just defensive.
Healthcare is not only defensive. Over the long term, the biggest catalyst for healthcare is the populations, or the age distribution of the populations.
Let me guess. The older people, the better it is for the sector, right?
Bingo. According to the Peterson KFF in 2016, 50 and over only accounted for 30% of the entire population, but spends over 56% of the total health spending.
Wow. And not to mention the baby boomers are now starting to need more health care.
That would definitely boost the earnings. Not to mention our technology advance, people can live longer now, which means longer healthcare spending periods.
Yeah, sounds bad, but yeah, sounds like we might see a golden 10 years or even 20 years for the sector.
A lot of people misunderstood the healthcare sector and think that it is not a growing sector and is not important for the American market, but actually America has the highest healthcare expenditure per capita in the world.
And in S&P, it is the second largest behind tech. So, if healthcare sector is not performing, the S&P won't be good either.
And in the past 10, 15, and 20 years, XLV beat the market. Only the past 5 years, tech carried the market and beat the healthcare sector.
Still, that is pretty impressive, and healthcare has tech too now, just like finance have fintech.
Yeah, I think biotech is an exciting industry, and since healthcare stocks have been down for the past few years with low valuation, now might be a great time to invest.
Okay, you made it sound easy, but it's actually hard to predict how a company will do just from its ER.
True, and even if you can understand the business model and logic behind it, there are still a few other wildcards that can increase the investment difficulty.
Such as drug regulations and government policies. I mean, it could get complicated.
Neither of us is working in the healthcare industry, so we don't have a very deep understanding of the industry itself.
But what we can do for you guys is some subsectors under healthcare and our logic behind investing in each subsector.
And that is something that we think everyone can understand.
So first one is drug development and biotech sector. This sector has really high R&D cost and many companies are involved with cutting-edge biotechnologies.
So they have the most growth potential in the entire health sector, but it is also the hardest to invest in. Their stock prices depend heavily on their drug development progress.
Such as the test results of different development phases and whether they can get FDA's final approval.
In this company have good news from experiments or approval from FDA, their stock can run 30 to even 50% in a day. But if they don't or get delay in progress, their stock won't move or even take a big dive.
So, if you're not really familiar or professional with drug companies, we do not recommend this subsector for long-term investing.
Second subsector is commercial health insurance companies. Their business model is similar to general insurance companies. Their core competency is whether they can keep their customers' health coverage with them.
And their ability to reinvest the money from their insurance revenue. So, these companies have both financial and healthcare characteristics.
And for that reason, healthcare insurance companies are most stable in terms of share price under the big healthcare sector.
Sounds like traditional value investors will stop watching right here, but don't go away. You might find other information useful too.
Absolutely. The most important logic behind investing in health insurance is that you can maximize your gains from the overall growth of the health sector.
Yep, from the increasing health expenditures year over year, longer average life expectancy, and increasing older population, the demand for health insurance will rise bigly.
Currently, the US health insurance is divided by a few companies, and United Health is one of the biggest. Its customers including government agencies, enterprises, and families, individuals.
The biggest risk for health insurance is government policies. Since the US don't have national health insurance coverage, to avoid expensive medical bills, majority of Americans will choose commercial health insurance, which is why health insurance is a well-established industry here.
Also, which means if the government decided to come out with a national health insurance, it will negatively impact the stock price for the health insurance companies.
Yep, that's pretty interesting. When the Democrats win the office, since they're pro-national health insurance, these stocks tend to get hammered.
Don't forget about medical devices and equipment stocks. This is one big part of the healthcare sector too.
Medical device companies make devices used to take care of patients. These devices range from simple ones, such as disposable gloves and thermometers, to very complex and extremely expensive, including artificial heart valves and robotic surgical systems.
Yep, that's why these companies are relying heavily on innovative products.
And most importantly, the product's gross margins.
I'm not surprised. Just like any other tech company that sells phone, computer, or even chips, the competitiveness of medical equipment is the technology and patents. The product gross margin can reflect on how accepting the product is by the healthcare industry.
Have you heard of Intuitive Surgical? They are probably one of the most iconic medical device companies.
They recently traded above $1,000 and went up a little over 10% in the recent month.
Wow, sounds like Tesla of healthcare. The company's Da Vinci surgical systems are dominating the market shares with 80%. And with the combination of artificial intelligence, this could potentially lead to a better surgical outcomes, fewer complications, faster recoveries, and, the most important thing, lower cost.
Yep, Intuitive Surgical has maintained a leading position for almost 20 years and will continue to dominate in the medical technology space.
On the downside, these type of companies require a long development cycle, just like the biomedical companies. Medical device companies also need a lot of investments in R&D and data collection. They also need to accept regulatory approval before going public. You're gonna have some faith if you plan on investing in them.
That's very true, but still, medical devices company are probably my favorite selection among the healthcare sector, unlike healthcare institutions.
Yeah, me too. I like medical device companies too, but definitely don't touch healthcare institutions like hospital stocks. They do not make money. You can go to the hospital every day and don't need to pay $1.
Well, that US law, right? Well, instead, you should also consider some miscellaneous health stocks.
Like Johnson & Johnson, they can often benefit from different branches and maximize profit from their patents and technologies in pharmaceuticals, medical devices, and consumer products.
Great company. They have good diversification in different healthcare sectors and show very stable performance in the recent years. So if you catch the phase 2 recovery train, this company should be on top of your list.
Love your suggestions. Be sure to check out our next update on more entries for some of the companies we mentioned today.
Thank you for watching. If you find this video helpful, feel free to give us a like and subscribe for more content like this.